Namaste and greetings. I, Samprita Banerjee, a researcher at IMPRI Impact and Policy Research Institute, Prabhav एवं नीति अनुसंधान संस्थान, New Delhi, extend my warmest welcome to you all to IMPRI Web Policy Learning. Today marks the second day of Healthcare and Gender Equity Cohort 3.0, theme Advancing Systems, Structures and Policies to Address Contemporary Challenges, an online international monsoon school program, a 4-day immersive online certificate training course. This program is organized by the IMPRI Gender Impact Study Center GISC. This program has an excellent panel of experts who will be sharing their expertise for the duration of this program. The distinguished expert panel includes Professor Vibhuti Patel ji, Professor Linda Lane ji, Ms. Jaya Velankar ji, Dr. Padma Bhate Deosthali ji, Professor Brunel D'Souza ji, Dr. Amar Jesani ji, Dr. Aksa Sheikh ji, Dr. Vina Vaswani ji, Dr. Anand Bhan ji. The conveners for the program from IMPRI are Mr. Farhad Yenepoya ji, Professor Vibhuti Patel ji, Dr. Vina Vaswani ji, Dr. Manorama Bakshi ji, Dr. Swati Santosh Rane ji, Dr. Simi Mehta ji, and Dr. Arjun Kumar ji. Proceeding further, I heartily welcome you all to this course, Healthcare and Gender Equity Cohort 3.0, theme Advancing Systems, Structures and Policies to Address Contemporary Challenges. This program will help you all embark on a journey into the intricate relationship between health and gender, a historical tapestry woven with complexities, shaping diverse gender perspectives on well-being. The transformative power of gender equality reverberates across health outcomes, fostering benefits for individuals and communities alike. Hence, this cohort of healthcare and gender equity unfolds as a crucial space for collective exploration, promising deep insights and contributions to the discourse on transformative inclusive healthcare systems. We sincerely appreciate your valuable time, energy, contributions, and deep enthusiasm for learning and discussing the nuances of healthcare and its relation to gender in detail. Thank you for your active involvement and commitment to learning and progressing. We hope that you take back a plethora of knowledge and valuable information from this course, which will effectively aid you in your respective field, along with causing a notable improvement in your skill set. We have also shared the course outline and reading resources via email for your kind reference and perusal. Before we start today's session, I would like to announce the housekeeping rules. It is imperative that you join the meeting on time. There will be a Q&A session after each presentation. Share your questions in the Q&A box and not in the chat box. The questions must not be posted as an anonymous attendee. Ensure that your questions are precise. Refrain from making general comments in the question to save time. Without further ado, let us begin with the program. I am delighted to invite Dr. Vina Vaswani, Director, Center for Ethics, Professor, Department of Forensic Medicine and Toxicology, Yenepoya, deemed to be University, Mangalore. Over to you, ma'am, for your remarks.
Thank you. Greetings to one and all. I'm happy to and privileged to introduce especially the second day unfolding before you. The program, which is literally a plethora of all the related gender, healthcare, under a huge spectrum umbrella, they're all tied together with the most chosen resource persons. The idea we are putting it for the 3O, healthcare, gender equity, cohort 3O. 3O is that imagine if we have a bottle which is labeled, no matter we change the content, people tend to think that the content is same as is labeled. If we were to do this course from Yenepoya University, people would look at it like, oh, it's only medical. It's medical related, nothing to do with us. So it has specially taken the leadership and vision from IMPRI. Together, we have come together with an impressive content because IMPRI caters to a plethora of skillful courses and knowledge-based technologies as well. So with that, it has given us a launch pad to bring the course with healthcare and gender equity. The reason being, you cannot restrict it only to medical. For too long, gender has been out of medical arena. And when we are talking about it, it doesn't come through as a comprehensive content if it comes only from doctors. So that is why you can't have a better choice for this course than the most impressive IMPRI and Yenepoya University, bringing it together, especially with the chosen resource person. As was the example in first O, we also in the first one we discussed about gender, health care, human rights, a plethora of cases, case studies. And now when we are embarking on 3, we are also bringing in a large way. Addition to this has been especially from the nursing perspective and also from the climate change perspective. So keeping in tune with the ears to the ground, what is the changing milieu, we are trying to incorporate that. And that is how we have before you and yet another similar course, but which is much enriched. Just like it was yesterday's, those who listened to engendering healthcare systems, we became acutely sensitive to the fact we have not been sensitized to. We see the things, but we can't see the direction, how it flows into. But only after yesterday, especially when brought into the plight of unorganized sector, not paid sectors, people who are made to work without wages and who lack dignity because of the gender, the same equivalent work would not be done by the other gender. So it was brought up beautifully in yesterday's lecture by Jaya Velankar, which was strongly supported by Amar as a root cause analysis of this gender disparity. If one brought about the roots of it, the other brought the tree form, the leaves, and the products and things together in a nutshell, giving the inputs as to what is the origin of this gender disparity, gender discrimination, how the patriarchal goes beyond the sex of male, but it becomes a part of learned behavior in our childhood. So that was beautifully discussed. So I'm very excited to embark on the day second, where we are discussing about the contemporary gender challenges, followed by gender health and climate change. So with that, I hand over my mic back to you. So carry on with this. Yeah. Thank you.
Thank you so much, ma'am, for such a wonderful introduction to the course. Now I would like to invite Professor Vibhuti Patelji, visiting distinguished Professor IMPRI, for her opening remarks. Over to you, ma'am.
Today, we are going to have a very far more elaborate discussion, in-depth discussion on the issues which were raised yesterday. First of all, I would like to express my heartfelt thanks to both Dr. Arjun Kumar and Dr. Vina Vaswani for curating this course so beautifully. And we are at a cohort 3. Still, so many newer dimensions have come up in this course, and that has also retained our interest. A brief recap of what happened to yesterday was we started with the feminist health movement and its achievement in terms of raising the issues of bodily autonomy, valuing paid and unpaid work, occupational health and safety, sexual harassment at workplace, equitable gender norms, and health financing, and also male biases in the development of R&D, vaccines, drugs, diagnostics, and also the need for leadership, not only representation, but the voice of women. Ms. Jaya Velankar, when she talked about, she began with the whole very important statement regarding the health as a state of complete, she quoted WHO definition of health, and also told about her organization, Jagori, which was the first to critique the mainstream psychiatry with the feminist perspective. She highlighted importance of health for all as a perspective which encompasses addressing hunger, malnutrition, safe drinking water, sanitation, and she also told us about the overall gender equality discourse, which revolves around the 5 important issues of structural violence, control over productive and reproductive labor, control over sexuality, no decision-making power, and restricted mobility. And she put forward the universal health coverage perspective with 3 characteristics, and Dr. Amar Jesani added the 4th one. So one was access to health services, challenging the gender patriarchal biases, acceptability of intersectional perspective, and also financial risk provision, and also quality of services and decent wages to the health workers, especially in the Indian context, ASHA workers. Then also Dr. Amar Jesani provided a profound historical review of last 500 years of medical, of health care services, because he says health is different from health services. And the modern healthcare system, which provided, how it provided the conditions to people to be healthy. He also told us about the painful history of considering traditional healers as witches, and how the witch hunting took place, and how the modern medical science is resting on the ashes of all those women, 1 million women during 500 years from 13th to 18th century, over the ashes of these traditional healers who were brutalized, victimized, stigmatized. And he also told the whole history of modern science, and he said that how the modern medical science, where the doctors were always, they were the most privileged people, and the formation of Lancet by Thomas Welke, and the question of self-regulation. Then the women as a natural carer, which was there in a pre-modern society, where and the modern medical science made a paradigm shift from women as a natural carer to women to be trained to be carer, and the hierarchy within the medical healthcare industry, where doctor is treated as a father figure, nurse becomes a mother figure, and the patients are infantilized and they are treated. And this has created so many conflicts over last 50 years. We hear about the violence against doctors, and mainly because of this patriarchal, very autocratic kind of behavior in which patients are treated. The question of diagnostics and therapeutics as looked as a masculine part, while the care is treated as a feminine. And he ended his presentation with saying that what we need is a revisioning of the whole part of diagnostic and therapeutics and caring. And he says caring should have a central understanding in the healing, central treatment in the healing, for healing purpose. And we need a humanistic approach as a priority, and we need to dismantle the hierarchy in medicine when it is getting more diversified and technology driven. And he shed light on various concealed aspects of gender-oriented perceptions, and he also deep reflection and introspection that we need in a medical science. And this was the participants also enriched the discussion by their intervention as well as the questions. So we had a very lively day one. Now over to IMPRI.
Thank you so much, ma'am, for your invaluable remarks. Now, moving on, I would like to invite Professor Linda Lane, Senior Lecturer, Department of Social Work, University of Gothenburg, Sweden, for the first session of the day, Contemporary Gender Challenges. Thank you for joining us, ma'am. Over to you.
Thank you very much. Am I audible? I'm hearing that I'm kind of low here. So yes, thank you very much. I'm going to begin by sharing my screen, if it goes well. Is it visible? I'm trying. Let me see. I have to maybe check one more time.
Yeah.
Zoom. Share screen. Just a second. I'm not. So we'll try now. So
yeah, it is true. Yes, it is true.
That's better.
It's in working.
So thank you very much. Yes, My name is Linda Lane. I'm in Sweden at the moment. And of course, that means that I'm coming to you with an outsider perspective about something that is very general in the sense that health applies to us all, but it's also very specific in the sense that context plays an important role. Where you are, the way you talk about what health is and the way health systems work is very specific to special context. So in my presentation today, I'm going to talk about accountability. I'm going to talk about how we talk about how we measure things around health systems. Specifically, I'm going to talk about, as an example, maternal health care systems. And I'm going to try to include an intersectionality approach to how we can deal with maternal health care. Now, first of all, I would like to thank IMPRI for the invitation to be here today. And I'd also like to send a heartfelt thanks to Ms. Jaya Vilankar and Dr. Jashani for their inspirational lectures yesterday, because they both provided food for thought and actually encouraged me to go back and have another look at my own presentation. And I think that is actually the best you can, the best way of learning and exchanging. So the structure of my presentation, I'm going to begin by saying a few words about the readings. Then I'm going to talk about defining accountability and trying to make a case for maternal health care as a way of exhibiting or understanding how accountability can work. I'm going to talk about an intersectionality approach and try to link a maternal health care systems to an intersectionality perspective and give some ideas about the way it could work. And this is, of course, followed by some conclusions. I do not have all of the answers here, but I hope I can open up for some thoughts, for some ideas, some questionings, some new ways of, thinking about the problem. So, the readings. Now, I kind of thought about them a lot when I included them in this for this lecture. They are difficult readings, I agree. They demand a lot from you as students, but I chose them with care because I think they actually, if you're willing to give them a chance, so to speak, I think you will learn a lot about very technicalities of healthcare systems in general, and just in this case, more specifically about maternal healthcare and reproductive rights. Two of them are, I guess you could say, systematic reviews, which means that you read one article and it encourages you to read 40 or 50 more. Now, I understand that you don't have a lot of time, you might not want to do that, but I would encourage you even so to give these articles a chance in your reading. If they're difficult, I think this is a part of what IMPRI wants us to do, is to encourage you to build groups, to study together. Maybe you can, in your everyday life with your colleagues at work, you can share them and, discuss them together, because these ways of talking about accountability in healthcare systems are the language. They are the technical language of those who make the decisions. So when you're talking about budgeting, when you're talking about who's accountable to whom, these are the kinds of language that is being used there. So I think it behooves us to know our enemy, so to speak, to learn who it is and how they talk about things that are of central importance to us as, people working in the healthcare sector, as doctors, nurses, other staff members, even as non-governmental organizations. We need to know how they talk about and what they talk about when they talk about accountability. Now, I've also included other readings of interest. These were not on the literature list, but I will share my PowerPoints with IMPRI, and I would suggest that if you have time, look at these. I will be talking about them in my lecture today. They are chosen again with care. primarily from Indian sources, and they are all available. They are not locked behind, none of the articles here are locked behind any kind of paywall. So if you're interested in them, they are available to you. So yeah, give them a chance. I think you will find that they can enrich your learning experience here. So without further ado, I will go over to saying something about accountability. Now, this is specifically discussed in the first article that I talked about in the reading list. This is Binnerhoff and Patel. It's an older article, but it, I think, really goes to the bottom, or gets, kind of encourages us to understand what accountability is. Now, there are three general categories. There's financial accountability, performance accountability, and political democratic accountability. And I'm going to say something that's a little bit in between them in just a few moments. Now, political accountability is what we need, or what we think we need. And we often ask ourselves, what do we want with accountability? Why is it there? Well, I would suggest that we need to be accountable because we all, as citizens, we want to know where our tax money is going. We want to know who's benefiting from all of the programs. We want to know whether or not they actually benefited, or maybe all of the ideas about who were going to be the beneficiaries was lost in corruption or whatever. We need to know that. We want to know in advance. So, not only do we want to know how our tax money is being used, we also, as users, as citizens, we want to be assured that we access programs, that we will be treated with respect and dignity. Somebody has to be accountable for us, that we are met with respect. And this is the kind of, issue that was discussed by Dr. Jasani yesterday about the ethics of care. Who is it that we are accountable for here? Now, financial accountability is about tracking and reporting and allocating, who gets what, when, and how. How do we decide who's going to be getting these kind of financial resources? And the tools we use here are auditing, budgeting, and accounting. And unfortunately, since I would say really since the 1980s and onwards, financial accountability has been the focus. There's a lot of effort and a lot of money spent to make financial accountability available. On the other hand, performance accountability, which refers to actually demonstrating and accounting for what we actually do. That is, the services we provide, the outputs and the results from those, has been taken, kind of as a second step behind. I would say nowadays that performance accountability is coming to the fore. People are demanding more in terms of knowing what kinds of services are actually being performed and the quality of those services. Now, my interests, when I talk about accountability, my interest has primarily been around political and democratic accountability. And that has to do with institutions and mechanisms that ensure that the governments and, parliaments actually do what they say they're going to do. So when they are out campaigning for our votes, when they are telling us all of the things they're going to do for us as citizens, I want to know where that money goes. I want to hold them accountable for the kinds of promises they make to me as a citizen. Now, this is all well and good, and we can talk about it. I will also talk about breaking down this kind of political democratic accountability category. But I think one of the things that we need to bring in here is also this kind of accountability and gender. Because as we heard yesterday, putting women in the equation has been the demand of women's organizations and women's movements since really, I would say, in a Western context, since the second feminist revolution that began in the 1960s. There have been a lot of trials and tribulations along the way, but it kind of ended, or at least a step in the right direction was the idea of gender mainstreaming. And this means that accountability, be it financial, performance, or political democratic, has to or should make an account for how gender mainstreaming is included in the allocation of resources. So we get this kind of idea that we are on the right way with gender mainstreaming, but I would suggest that while it is the baseline start for any form of accountability nowadays, it might not be enough. Now, one of the major critiques of gender accountability is the fact that sex and gender is kind of considered as one thing that we can measure, and we know that there are distinct differences in, when we talk about gender, and that we can actually allocate people to certain genders. And we can say that, with the inference of gender mainstreaming, if this were the case, then gender accountability would be the way of forming some kind of integral accountability. The problem is that, while we have an obligation to use gender might not be enough. And it suggests that, that we assume that we all have gender identities that can be easily identified, but maybe that's not just the case. I'm thinking primarily about India, where now you've kind of realized that, yeah, we have some work to do here, and you've included a third gender in your, in your statistics, which means that hijras and other groups are included. But it might be the case that we need to kind of move away from that as well, and kind of understand that they might not easily translate into cultural differences and cultural identities about gender, that, we need to move away from biological or ideas about gender altogether. So my argument in this lecture is that gender is necessary, but it might not be a sufficient category to understand the needs of birthing people. And I'm using the kind of idea of birthing people as a way of being inclusive of all categories of females who give birth. So this is trans women, the whole, transgender people, the whole idea, so the whole spectrum. As I said before, we need to maybe consider how political democratic accountability can be further deconstructed. Because just saying, going to vote and demanding accountability based on how we voted might not meet the needs of people who are most vulnerable. And I would include here, and it's also a part of the literature and the text that I've assigned to this part of the lecture, that we think about social accountability. And this refers to focusing on civil engagement. How do we engage with ordinary citizens? How do we engage with civil society organizations? How do they directly participate in policymaking processes? Here again, I would refer again to the lectures yesterday, where we saw the importance of civil organizations, the importance of the women's movement for bringing to the fore the needs and the healthcare situations that are specific to women under a long period of time, but also hearing the voice of people, of citizens. The problem now, when we think about breaking this down to different levels, is that citizens may have a legitimate complaint, but they may not have the power to enforce or demand change. So, we can never quit. We have to continue this process of engagement, listening, making progress, and then starting the process over again is a part of what we need to do if we're going to be able to hold politicians, other leaders accountable for the needs of citizens from a grassroots perspective. I'd like to tell you a story. Your wealth may not save you is the way I'm going to start this. And it has to do with the fact that, while we know that statistics need to be disaggregated, as I pointed out around the complaints or the critique of gender mainstreaming, maybe we need to look at more different identities, etc. But we also need to think about what happens when the birthing person is not just one category, but maybe a complex mixture of several categories. And I think the story of Serena Williams will kind of illustrate that. For those of you who don't know, or, if you maybe not, but Serena Williams is a very famous person. She's probably the most decorated tennis player ever. She's won lots of championships. She's always been on the news and in the sports sections about her her sports prowess. But you might not know that Serena quit tennis and she got married and she had a baby. And she went into, labor in fantastic physical shape. She had not given birth before, but because of her wealth and her status, she got excellent prenatal care. She knew when she went into labor that she would not be able to deliver vaginally, so a C-section was planned. And immediately after the surgery, everything was well. The next day, she experienced a shortness of breath and couldn't breathe and had difficulties. Even when she tried to raise the issue with the nursing staff, they dismissed her. It was only when she used her status as a wealthy person that they, could no longer neglect her. So what happens is finally, because of her raising her voice, more tests were run, and they found that she had blood clots in her lungs and at the site of her C-section. 2 further surgeries were necessary for her to be well. And, it took a long time for her to recover. Finally, she was dismissed from the hospital. So what does the story tell you? Well, I think it illustrates very clearly that being wealthy might not be what is going to save you in a situation when we're talking about maternal health care. If your voice is not heard, and I think Dr. Vaswani made it very clear yesterday about how patients, the mother, the birthing person, may be completely neglected. Her experiences of her body, of understanding who she is, may not be considered when she's up against the medical profession. And in this case, the nurses and some doctors decided that they knew better what was right for Serena Williams than she knew for herself. Also, as we discussed yesterday, this is a clear illustration of the way that there is a long history of bias in health systems, that we often do not respect the birthing person, and that when we cry out, we are considered hysterical or emotional, and that there's also still and remains clear levels of discrimination in the medical system. And it's built around gender, but it also may include race, religion, and other categories of difference, such as substance abuse or mental health issues. Now, what I would suggest here is, if we can learn something from this short story, is that, health, gender is one issue, but it is not everything. And we need to kind of find ways of being more inclusive of the experiences of the birthing person and to integrate them into maternal health care systems. So one of the things that we have noticed when we try to go to grips with this and trying to figure out ways about how we can, demand more accountability is to first realize that in general, birthing persons have little power, as the Serena Williams case illustrates. Gatekeepers, doctors, nurses, etc., limit, birthing persons' opportunities to evaluate their own situation. Their statement is, these birthing persons should be grateful that we are there at all. We are doing them a service. Furthermore, if the person has, a grievance, they have poor access to the legal system. And this may be because of poverty, lack of education, or any other number of reasons. So in general, we can say that birthing persons find it difficult to demand accountability or even to resist the sanctions that themselves are placed upon them when they dare to to raise their voices. Now, theoretically, we can say that in democracies, these birthing persons could demand more. They can vote out these governments that don't meet their needs. But often, the demand or the grievances are not at the state level. They're at the individual level in hospitals, in healthcare centers, primary care centers, prenatal, antenatal clinics, etc. So two questions arise. Who is accountable? And to whom are they accountable? So, trying to break down this kind of accountability to something that is kind of tangible for us in our everyday practice. Who is it, and who are we going to talk to about that? One way of approaching this is to kind of take it from an international intersectionality perspective, to try to see who it is that is accountable and who are they accountable to. Because, as I said previously, the category gender in itself needs to be deconstructed. We need to kind of put some names to these different varieties of or maybe we could call them subcategories of woman. We need to deconstruct woman in this issue. So we can, with an intersectionality approach, it helps us to remain cognizant of the fact that people have multiple identities. Serena Williams was not just a wealthy, well-known sports personality. She was at this point a birthing person, and she had medical issues that needed to be resolved. An intersectionality approach also helps us to understand intersecting power relations that shape people, their social identities, their experiences, the social norms, values, and codes through which their lives are governed, not only when they meet medical professionals, but also in the households, in their local communities and schools. It was lifted yesterday in the lectures about how, patriarchy is definitely not dead, and it imbues everything, so that when we finally get to the hospital or to the primary care, the situation is more or less predetermined. Intersectionality hypothesizes that different accesses of power and domination may be important in different contexts, and they're changeable over time. It also allows us to explore gendered power relations when they interact with inequality. Now, in two of the readings that I, suggested, one of them is about the implementation of cash transfers to mothers in household below the poverty line in Tamil Nadu. This is a very illustrative paper that helps us understand why the category woman needs to be deconstructed. Now, in this, the idea was that women below the poverty line would get access to a certain amount of money to help them prepare for being mothers, to help with nutrition before birth, all of these good things. Okay, it wasn't a lot of money, but it was a start. This study shows that, of course, they did, but most of the women who were left out were MBCs, STs, and other per women, both rural, and urban. So when we just look at women, we don't see the ones who are not there. I would definitely suggest that you take a look at this article if you're interested in understanding that. The second article talks about the situation of Muslims and of Adivasi women in the Northeast. And here the authors want to discuss how per women, based on religion, or in this case, whether or not they were indigenous women, are treated with disrespect and abuse when they come to often public hospitals or to public's, primary care because of their poverty, as was discussed yesterday. Maybe they, they don't have access to private care, but just the idea that the medical staff took it upon themselves to discriminate these women based on the fact, among other things, that this idea that Muslim and Adivasi women are doing the wrong kind of, or have the wrong kind of fertility. They have too many kids, they do things differently. So we need to be aware of this when we're talking about how women are met in terms of their, intersectional identities. Intersectionality will help us with that. Keep always in mind that intersectionality analyses are not a universal panacea. It will not solve all of the problems, but it will help us see where they are and help us understand what we can do to improve the situation. Yeah. So what kinds of accountability have been found to work? Yeah. If you listen to accountants, they will always say financial accountability is the best way forward. We can mark every dollar, every rupee, every Swedish crown. We know where it is. I would suggest that that is really kind of poor accountability, and it doesn't really kind of meet the needs of the citizens who are there. But the challenge is to how do we do that? If we want to deconstruct the category woman, which I think is necessary, how can we embed that in clinical practice, in our everyday practice of giving maternal health care? Now, this requires medical institutions themselves to recognize the power structures within medicine and healthcare, and those that reinforce inequalities or inequities. This was spoken and discussed yesterday, so I won't have to lift that again, but we have to kind of reflect and act to kind of reckon with the power and privilege within medicine, including the structures that favor, okay, in this case, we are talking about racialized white, cisgender, and heterosexual men, whether it's testing medicines or giving special care, all of these things. Why is it always these categories that are favored? We need to reflect on that. In the Indian case, maybe we have, another construct of categories that would be the central ones here. So where do we go from here then, if that is the case? What are some of the social accountability initiatives that have been implemented, and how do they work? Now, there are many ways of talking about this. We can talk about quantitative assessment and data collections. That is good. We need that because we need, as I said, to deconstruct this idea of gender to be more inclusive. You know, we need to get away maybe from the 2-gender or the 3-gender to realize that there are other ways of thinking about how we can categorize the gender. For example, research shows that economic status, educational status, place of residence, whether it's rural or urban, marital status, are probably the biggest challenges for maternal health care. So being being unwed, living maybe in a rural setting or in an urban slum situation, all are guarantees to getting less well-documented health care, maternal health care. Qualitative data needs to be collected as well. So if we continue with the idea that if we're going to have aggregated data for quantitative research, we need to keep pushing for, you know, more of the same that not only talks about gender, but also includes other categories of discrimination that might arise. And this was something that I think both Mrs. Vilankar or Dr. Vaswani talked about yesterday. Now, qualitative research or qualitative aspects of accountability are not often discussed. I mean, it's usually a focus on how we can get more disaggregated data in a quantitative aspect. But as a researcher who spent a lot of my time talking about participatory, grassroots organizing, ways of seeing, you know, ways of including experiences of people at the grassroots level, I'm arguing that social accountability that includes quantitative methods or quantitative tools can also help us understand clearly or more clearly these kind of intersecting aspects of how maternal health is organized, how it is implemented, and how it is actually carried out in the local milieu. Now, feminist researchers have further developed participatory approaches that are sensitive to gendered power and their processes. And I'm going to kind of just name drop a couple of those. So I think both, maybe these all well known to you, but if not, one way forward in terms of this kind of, I guess you could say, emancipatory, participatory aspect is the implementation of the Respectful Maternity Care Charter. I'm not really sure if that's something that's been discussed in the Indian context, but it was initiated in 2011 and updated in 2019, I think. And it is the, you know, WHO's organization statement on the prevention and elimination of disrespect and abuse during facility-based childbirth, and to publicly declare that health facility values and establish baselines expectations of care. So by implementing this respectful maternity charter, it's a step in the right direction. The other is to kind of open up for the discussion of bottom-up participatory approaches, which may include things like the community scorecard, SCS, and so a social accountability tool, and birthing body mapping. Now, these are two approaches that I have chosen. I'm sure there are lots others out there, but I chose them because they have a history of work being done in India. I mean, it kind of takes into all of the aspects of maybe having limited resources. How can we do this when we have limited resources, where maybe people have, poor literacy, or, all of these things that maybe if you were just looking at it from a quantitative perspective would be discouraging. So, these kinds of tools, they are available. They don't require a lot of money, but they do require persons who are interested in ensuring that birthing persons' voices are heard and that medical professions are made accountable to this group of people. Now, the community scorecard is a tool that creates opportunities for communities to work together to identify innovative ways of dealing with service sector, service delivery, and universal utilization and challenges that they face. If of the material that I have in the extra readings, you can look at the article by, I think it is, let me see, Kiraku. It's a study of Uganda, from Uganda, but I think it is very much applicable to the Indian context. And there are scorecard studies that have been done in India as well. Body mapping is birthing body mapping is another tool that I think is very interesting, and it has lots of applications. And this tool, it's a way that gets women who may be not among the selected elite to talk about their experiences, their body experiences of giving birth, of the kind of persons, the expectations from the medical staff, how they were treated, how they felt, what they wanted, did it meet their expectations? Again, it's a way of saying these women, whether they are literate or not, they can draw, they can put on a piece of paper. This is what I felt like when I was there, when I was not seen, when I was not treated as a whole person. So, of course, these are just some tools. They will not solve the whole problem. But I think that if we can take on board qualitative approaches that are inclusive of an intersectionality perspective, then they will help us make more sense of the quantitative data. So maybe, if I was talking from my own perspective as a researcher, I would say I'm advocating for a mixed method approach to studying maternal health care. So when we think about this, we can also, look at some of the things that have been going on out in the rest of the world and how they have kind of encouraged, ways of reimagining global maternal health in the community. These are just some examples. For example, in Argentina, the Ministry of Health has, found that if they create private labor rooms, that the birthing person is given more respect. Now, that might not be applicable in the Indian context. What do I know? But, this is something that is found to be of help. The other is, paying attention to the people who work, the medical staff, making sure they have adequate wages, making sure that they're not being, working too long hours, that they have a relatively, as best we can, environment to provide care in. These are important. It was mentioned yesterday. I can also bring to the fore that just now in Sweden, we had a strike by nurses this spring, and their demand was not primarily for more pay, but for better working conditions. so that they had, that they could do better, give better care to patients when they came to hospitals, whether or not it was, for maternal care or other forms of care. They wanted better working environments. Another thing that has been brought up is the fact that we should stop criminalizing LGBTQIA plus people and barring them from women serving spaces. You might have heard of the discussion in the United States now that's been very active about, should trans women be allowed to use the same toilet facilities as women? This becomes very interesting, when we start talking about this from an intersectionality perspective. How can we, reduce these barriers, not just in, outside of the maternity wards or in maternal, prenatal or antenatal care, but generally. And one, thing that was very central here for me is the role of professional organizations, accrediting bodies, licensing organizations. How can they embed intersectionality in clinical settings by, they need to be better and more inclusive about curricula and providing in-service education and continuing education systems. Because the books we read as students, they tell us how we're supposed to be as professionals. So we need to be inclusive of, expanding curricula, making sure that intersectionality or gender is included in the way we talk about the medical profession and the in-service education, but also programs like the one we are attending today, that, is a continuing education program to try to help us stay abreast of things that are changing and the way of the world, and how we can, as citizens and as healthcare providers or people who are generally interested working in our organizations, can deal with this in a more concerted way. So briefly, that is what I wanted to say. We can conclude by, saying that, yeah, accountability is necessary. We can't get away from it. We need it. We need to demand more accountability, but I would suggest the right kind of accountability. And that means it should not only focus financial accountability. It should look at other forms. And I hope that my talk has kind of generated some thoughts about how that can be done. Gender mainstreaming is a baseline starting point. It must be there. It's mandate for it to be there. But I think that an intersectionality approach can both complicate and clarify existing problems and gaps in maternal health care. Further, intersectionality approaches offers recommendations that can help us realize SDG goals and improve the provision of maternal health care in both long and short-term perspectives. And last but not least, I think we must never underestimate the work of feminist and women's movements around the world that have spearheaded the struggle for women's health in general, and more specifically for maternal and reproductive health. So with that, thank you very much.
Thank you so much, ma'am, for your insights and perspectives. They were deeply informative and thought-provoking. I would now like to invite the chair, Professor Vibhuti Patel ji, for her remarks to the session. Over to you, ma'am.
Dr. Lida Lane has rightly told us that we need accountability system, and she gives so many important examples where accountability in the health system that involves assessing performance of all the actors, not only doctors and nurses and health care professionals, but even the politicians who come up with the bureaucracy, and the bureaucrats and administrators, as we saw during pandemic. Why did they convert maternity ward into COVID ward? And so many women had to deliver babies on the roads, or they were not even allowed entry in the hospitals, no government hospitals. And So this kind of, and which created so much human misery, and even the
Mhm.
record of the how many women delivered, only 17% women were registered. That means complete chaos was created. So the obligation and of the individual health workers, and also the systems and rules and regulations and policies that we have. We have seen this in case of the use of new reproductive technologies, how they are used for getting son. Even after the PCP&DT Act and so many, these things, doctors are violating it. And what is the accountability system? What is the power to the police that is given? Can vigilant committees and appropriate authority control this kind of a menace? In fact, during the pandemic, even PCP&DT was freezed. So many unrecorded sex selective abortions took place, no? I just wanted to ask one question, that only in North African region, you can see massive reduction in maternal mortality has taken place, no, during the Millennium Development Goals, and now I think even they have attained the Sustainable Development Goal. What kind of accountability system they had created? And another thing I want to say is about the more optimistic work which Dr. Vina Vaswani has done about the LGBT, about the transgender person. She works, it is a private medical hospital, and the way she has worked and humanized the whole institutional ethos, I would like her to share her experience of working with the transgender community. Yeah, and she can also comment on your, because she is the one practicing person, practicing doctor. So how has she faced this accountability system? Yeah.
Yeah, good evening. It was a wonderful presentation, Professor Lindelane. It's eye-opening. And no matter how much you think you know about gender in a particular context, the moment you hear somebody else bring some other context, it is totally enriching experience. Because it is not the copy-paste experience everyone has. There are some similarities, but then there are also uniqueness. So, because we had a similar thing, a thought process post-COVID, when we reached out to the transgender people and the kind of troubles that they had, which couldn't have been articulated if we did not do an in-depth interview with each of them lasting for 1.5 hours over many, many days of sitting across table just for discussion, just for tea, coffee, to build or gain trust. Because the question is, they would think, what do you gain from talking to them? Are you pitying them? So the very first fact is that we do not know much about you, which is our fault, but we are open for learning now. So that was nice that we could have a couple of camps for them. We reached their doorstep and we took the healthcare, including the dental vans and dental care to healthcare to hormonal treatment, whatever was stopped, we could ask them, and we made a list of things that we could. Now we are in the process of getting them a health card. So the what we are ready to give is not necessarily what they want, because their tensions lie elsewhere. But to have somebody talk across, to tell them that this is what we have, but we'll try to get something that you really need because they want a roof on their heads. That is the absolute basic necessity. You'll be shocked to know that for the same room as we, as what you call cisgenders, if we pay 2,000, from transgender 5.5 to 6,000 is taken. It is literally 3 times. And during COVID, most of the people had their house rent raised. Either you stay or you get out. So they went to run to the money lenders to get money to manage. So there are a lot of things people go through. So to begin with is to build a solid bridge of trust. And when we think we have just built it, then they're ready to negotiate or talk and come out with their. So thank you, Vibhuti madam, for bringing that, because we have every month a community engagement program. We have no agenda, no set agenda, no research, nothing. We just want them to come, have some good time, sometimes some documentary, and then we want to talk and how are you doing, what are you doing. There's sometimes very little that they want. One of the girl is studying degree for commerce, so we are paying for her tuition. Somebody else English classes, we are trying to do that in a small way, in a specific way, but not as for the entire community, because it's so difficult to get them under one roof to make one particular need statement. So that is why we think that whatever they require in a small way, we are able to fulfill it, and we're going to meet over a cup of tea. Now we want to start another program called Within Us. Others should invite them to their house to build up on their self-esteem. So because we are bringing them to college is a very impersonal thing. But if we could invite them home, introduce them to my mom, dad, uncle, aunt, whoever, then probably they'll start feeling that, okay, we do recognize them as one of us and not like only to be treated in the hospital premises. Yeah. Thank you.
In Bombay also, they are saying that you meet us in conferences and seminars and official functions, but none of you invite us at your residence. That is everywhere. I think they say. So main thing is, see, when they come, you have to do lot of sensitization of the liftman, gardener, watchman, neighbors. Maybe not trivialize them, but like when we invite, when during the pandemic, we heard so many stories, and when the one transgender person committed suicide, it became a big news also in the city. And our college, women's college, Maniben Nanavati Women's School, we decided to exclusively direct our relief operations to transgender community. We contacted the organization. When they came, they entered the campus. Can you imagine the watchman, peon, the gardeners, they all started whistling. We had never seen, we thought, oh, all these people are protectors of the campus and they are gentlemen and all. And after that, we had to conduct a workshop that this is not the way you treat people. And it was the atmosphere became so vicious, and we also felt extremely embarrassed that our staff can behave like that. Imagine the college was founded by a person who worked with Mahatma Gandhi, Maniben. So I think a lot of preliminary work we have to do before this thing, so that they don't feel humiliated when they come. They are the guests, they have to be respected and they have to be treated as equal. So in course of time, things change. So now even our extension work and NSS work is also with them. Students and teachers, they were sensitive. But when the other staff, they were behaving in a objectionable and inhuman manner. And we also had a complaints that doctors refused to touch them. They refused to examine them, Even during that pandemic, none of the hospitals doctors were ready to even examine them or get them in,
In fact, one of the transgender person who we interviewed, she was very, very vocal about it. That when it came to even giving vaccine, they threw the cotton swab on her. And they said, you apply it here.
Yeah.
And they stood at such a distance. And they were trying to jab her as though you're jabbing cattle or something.
When cattle should not be jabbed.
That's what exactly. No, she meant that they have a big needle and they have to use force. But because they were staying so far away and they were trying to do it. And she said it looked like we were the coronaviruses. They were treating us so badly.
So I think a lot of sensitization of the medical professionals also need to be done.
Yes, ma'am.
That's
absolutely
bias we have seen in the Patel Tadvi case, the condition in which she had to commit suicide. My daughter is fighting her case. But how 3 affluent doctors, her colleagues only tortured her and forced her into suicide. So similarly, I think stigmatization of so many people, and transgender the most.
Yeah, that's true.
I wanted to know about the North Africa. How did they reduce? What accountability system they had from 2000 to 2024 that they have reached now? They have attained all the targets of Sustainable Development Goals so far as maternal health is concerned. If Dr. Linda, if you are familiar with any of the literature.
Not specifically. I know that the North African countries, but again, we're looking primarily at, they're looking at, this kind of disaggregated data around numbers. The specifics around, tribal communities, rural communities it's very iffy. I would say that, I think it's very important to recognize that the goals have been met, given the criteria for reporting. But I think if we kind of disaggregate that and look into the specifics of it, we'll find that there are whole communities who have not been serviced for different reasons. And again, it would be a bit like in the Indian context, where there's kind of a systematic discrimination of certain groups, and so their service needs quite simply are not met. On the other hand, I also know that this kind of community scorecard, using a more kind of participatory approach, has been used in some North African countries. But the problem here is that the scorecard is qualitative. That means you don't have like thousands of people
Numbers and percentages.
you use a small percentage. And when you're dealing with, patriarchy issues, numbers, what you measure is what is the most important. So if you can't quantify it, it's not useful. So, so a lot of the qualitative research that has been done around scorecarding, around birth mapping, for example, birth body mapping, other kinds of alternative approaches have not been, they really are not included in
The
this
triangulation
statistical
doesn't
group.
happen. Like you
No.
have a metadata of the country.
No,
and then you
unfortunately.
That is the strength of Indian data system, because we have a metadata through census and even NFHS and National Sample Survey. Thank you for that. This is a new insight I got about that. Qualitative sampling is done for that.
Thank you so much, ma'am. The floor is now open to questions from the audience. You can write your questions in the Q&A box or raise your hands and only unmute and speak. If there are any questions, now's the time to ask. So please ask your questions. Yes, Alicia ji, you can go ahead.
Hi, good evening, everybody. Can you hear me?
Yes.
Okay. Just to start off, thank you so much, Professor Lindalin. That was a really, really nice, concise presentation of so much information. I really appreciate it. My question is specifically because you are a researcher, and this is something that I have encountered, and as an organization also we've been encountering. So I'll just give you a little bit of context. I work in Mumbai with an organization that is trying to prevent and heal child sexual abuse. So along with implementing our programs side by side, obviously we are doing assessments and evaluations constantly. And I am bringing this up specifically because you spoke about accountability, and that's a big part of doing these kind of studies. And it's so important to put information out there for other organizations as well, and general public, everybody. But specifically when we are working with children and trying to do interviews, it's a little difficult because oftentimes these are interviews that happen years after the implementation, and you don't want to trigger, you don't want to bring up anything uncomfortable, even if they've gone through something, not gone through, you don't know. But that's my question as a researcher, and because we're speaking about accountability, I would want to be accountable to the people reading that impact report, but I'm also accountable to those children as my beneficiaries. So where do I find the balance there?
Yeah, that is a very tricky question, and
Yeah,
especially
I
around
agree.
the ethics of children and violence. I've been doing a bit of research the last few years around violence, and one of the things that has sustained us in this, this research is ethics first. Ethics first. That is children cannot consent. They cannot. They are at your mercy. So as the organization, you have to find a way of trying to elicit the child's, experiences. And this can be done in a lot of different ways. I mean, maybe you can do it in a nonverbal way, depending on the age of the child. And, this can be done through play. It can be done through artwork. All of these things are, methods are available so that you can obtain the experience without violating the child further or triggering, as you say, maybe other responses. On the other hand, you're in a very complex balance, maybe because you also have to kind of, to the people who are donating money to you or to the funding agencies, you have a responsibility back to them. So how can you make clear the kind of complex situation that you're dealing with when you're trying to talk about the violence that is perpetrated on children to a donor who maybe only looks at financial accountability? So I would say, I don't have an answer here, but I think, you have to kind of help the donor or the funders to understand what you're doing. And this can be done, again, maybe through a mission statement, making clear this is what we do, stating very clearly before you take their money, these are the ethics that we adhere to in this organization. And again, maybe approaching the child through alternative methods rather than direct interview, using art or storytelling, play, and other ways, other tools to gain the information you need. So I don't know if that's helpful, but we found that in the Swedish context, that usually is the way to go, because as you know, maybe in here, the ethics situation is very strong. And, we would not be given access to children if we did not adhere to them, so yeah, that maybe that's helpful. I hope so in any case.
It absolutely is, ma'am. Thank you so much. Thanks a lot.
I would just, also like to say that, maybe when you're listening to this kind of presentation, you go, maybe you don't see yourself there. You don't, who am I when I, as a person, a medical staff person or working in an NGO, maybe you don't think of yourself as in this kind of accountability situation. But we all are, if I'm working with as a social worker, or if I'm working as whatever, where my job is to help people help themselves, because that's what I'm there for, to help them to help themselves. I have to kind of reflect on who I am when I go into that situation. So what kind of burdens do I carry with me on my back? What kind of ideas and discriminatory behaviors that I have with me? Because, we all like to think we are not biased. We want to believe that we are just free-floating. We don't discriminate. Everybody, we love everybody, but we don't. We don't. We have, we are also a part of the societies in which we grew up in, the kind of context and the experiences that we have had. So I'm thinking quite seriously about the examples that were just mentioned about how trans persons have been met in the Indian context. We'd like to say that we would not be that person who did those things. But it's quite possible that in the right situation, we could very well be that person. So the only way we can inoculate ourselves is to reflect constantly on who we are and where we are in every situation, when we are there to help people who are at our, they have no other place to go. And it doesn't have to be about poverty, as I try to illustrate with the case of Serena Williams. You can have all the money in the world, but if the medical staff, whatever, is not prepared to see your need, your wealth will not save you. So, I don't know. Just feel free, if you feel like you want to ask something, do so. Otherwise, I'm going to stop talking now.
Can we now have introduction of remaining participants? Yeah.
Sure, ma'am. So now we would like to move on to the participants' introduction. for the participants' introduction, you need to say about your organization, your location, why you wish to join this Monsoon school, your name, and any other details that you wish to share. So moving on with those who could not give their introductions yesterday, you feel free to start and give your introductions one by one. Also, kindly accept the request to join as a panelist in order to switch on your video for the introduction.
Who is starting now? Can we go alphabetically?
Yes, ma'am. Sure.
Yeah.
I think we can start off with Bhavya Singh ji.
Yeah.
She has accepted the request to join as a panelist. If you can go ahead and give your introduction.
Yeah.
Good evening. Am I audible?
Yes.
Am I visible?
No, you are not visible. But, oh, again you got muted. No, this Bhavya changed. Okay, you are, yeah, your background is visible, but you are not visible, but you are audible. Please go ahead. Yeah.
Okay. I'm very sorry if my video is not visible. I hope. My name is Bhavya Singh, and currently I'm pursuing PhD Psychology honors. And if I talk about today's sessions, I really enjoyed, ma'am, and especially the information that you recently shared. So, like, I'm a person who has gone through the same, because, like, even though, like, somewhere we do know about the fact that, everyone is equal, we should love everyone and all, but the minute we face that behavior, and somewhere we do have this toxic positivity, that it's okay, some people do have the worst situation than us, but what I believe is that it doesn't mean that just because someone is suffering worse than us, it doesn't mean that our situation should also be ignored. So I also I really love the fact that you straightforwardly stated the point. And thank you so much for the information. That was a very informative session that you shared about it today. And the key word that you highlighted, accountability and responsibility. That word. Thank you so much.
Thank you so much for your introduction. I think we can move on to Ifi Yinchuku Akuma. If you're here, kindly give your introduction.
Hello, good evening. Am I audible?
Yes. You.
Okay, my name is Akuma Ifanchuku, originally from Nigeria, but currently in India. I'm a PhD research scholar in the Center for Ethics in Yenepoya, into the University of Mangalore. So it's quite pleasurable joining this year's Monsoon. During my MSc program, I had the privilege to join the previous meeting, so I found it interesting. And the opportunity was given to me by my guide, Dr. Vina, Vaswani, and I took that opportunity. So I look forward to learning new things. Thank you.
Yeah.
Thank you so much. We can move ahead with Shobhana Kartikeya ji, and also kindly accept the request for joining as a panelist to be able to switch on your video. It's a request to all the participants.
Shobhana.
Good evening, everybody. I'm very happy to be a part of this program. Ma'am, I am working as an assistant professor in the Department of Economics, Madras Christian College. And to be very honest, I'm dabbling in gender economics research. So the reason for taking up gender economics as a research area or a point of interest is that it is practically everywhere, right from home, right from the academia. It's extremely heavily male oriented as such. So when I look at all that, and when I look at the plight of an urban educated doctoral person trying to negotiate my way through, so I only shudder at the thought of how others, women who are less privileged, who are less educated, have it. Therefore, that is the primary reason to see, I mean, where are the blocks? The blocks are everywhere. So if I don't, as a researcher, I don't take cognizance, pass it on, sensitize my students, my community, I will be failing in my duty. So I wanted to know more about it, get more perspectives on it, read up as much as possible. So that's why I am in this Monsoon school today. Thank you so much, ma'am.
Thank you, Professor Shubh. Yeah.
Thank you so much for the introduction.
I
We
think
can move
Aishwarya
on.
is-
Okay, yes, ma'am. We can move on to Aishwarya Reddy ji.
Yeah.
Kindly give your introduction.
Hello. Good evening to everybody. Previously, I didn't know about IMPRI, and I was a bit hesitant. Is this course is this webinar is useful for me or not? But yesterday I joined, and I'm so much grateful to have this community and to listen to all these thoughtful process going on. So first, thank you for all these lectures. I'm gynecologist by profession. I'm working since last 10 years. So my first 7 to 8 years, I work like a typical doctor. I work in a peripheral area, in tribal area of India, in Chhattisgarh state. But over the last 3 4 years, I started thinking about the patriarchy in medicine, and also I had experiences because of my female gender, the experiences in professional life as well as in my personal life. So I understood that just because of my gender, I'm getting the partial treatment, and I am experiencing some injustice. So the last 2 to 3 years, I am on this journey to understand this gender inequality or patriarchy in medicine in thorough, and I'm reading a lot of material since last year. So about the history of medicine and how women are left behind, and how women struggle, feminist movement struggle to get admission in the medical colleges and all of that. So last year was very thought provoking for me. First time I learned about these aspects in medicine, and I felt very bad that now I turned 38 years of my age, and I thought why nobody told me this before when I was young, when I was learning MBBS. So I felt this is a big loophole in our education system, that at such a later age I came to understand all these things, which should have told by my professors at very younger age. So I would have been better physician, better surgeon. So this is going on, and I'm writer too. So I write in Marathi language in Maharashtra. So in my writing, I'm incorporating all these elements, that how the patriarchy in medicine is affecting society, the women, and also the doctors. So in my writing, I'm trying to build all these elements so the people should get aware that how the medicine system is working and how there is hierarchy in that system too. So currently, I'm on that mission to bring these elements in my writing. So this webinar is really helpful for me to enhance my understanding about this subject. So thank you.
Thank you, Dr. Aishwarya. Yeah.
Thank you so much. We can move on to RTAG. If you are here, kindly give your introduction.
Hello.
Yeah.
Good evening.
Yeah, good evening.
I'm Aarti, and I'm currently working as a tutor in Center for Ethics, Yenepoya, deemed to be university. And I'm very happy to attend this workshop. And as already Vibhuti ma'am mentioned, that our center is already leading towards building a much more humanized ethos in our institute. And through this course, I believe I will be able to increase my understanding, build my own existing understanding, so that I will be able to add in the ongoing program which we already have in the center.
Thank you.
Thank you so much. Alisha Bijliwala ji, if you're here, kindly give your introduction.
Hi, everybody. Good evening. As I said, my name is Alisha. I'm based in Mumbai, working in an organization called Arpan. But the reason I've decided to join this series is because honestly, I come from a very corporate background where I was thinking about very different things until about a year and a half ago. But I did, there were some reasons I decided that I wanted to do something more productive. So I made this shift. So honestly, all of this is very new to me, but I'm trying to get the hang of it. I'm very grateful, as someone said earlier, to have this community, to have so many of you sharing your experiences and your wisdom with us. So yeah, thank you so much.
Thank you so much. We can move on to Ananya Verma ji. Kindly give your introduction.
Hi, I already gave my introduction yesterday. Do you want me to go again?
Yeah, she gave yesterday. Only
Yeah.
Aishwarya, the G has written that she works in Cochin. In the chat box, she has written that but I forgot to mention, I work in Cochin in birth facility started by midwife. Working with midwife made me see things in a new perspective. It healed my traumas created by patriarchy in medicine. Yeah. Okay. Thank you, Aishwarya ji. This is such a nice testimony you have given. It's really humbling. Yeah.
We can then move on to Bedavrat Sharma ji. Kindly give your introduction.
Please go ahead, Bedavrat ji. You are unmuted. Can't hear. I think maybe it's raining in this place. Yeah. Gulam Hariyappa ji.
Yes, good evening. Sorry, there's been a little bit of disruption. Like you rightly said, the weather is kind of getting the connections a little wonky. Anyways, today, round two, I thoroughly enjoyed the discussions, a different perspective, getting to see how, different parts of society is in a way creating these thought-provoking ways in which all of us are here together thinking about ways in which we can change. I want to advocate through public policy as to how we can actually bring about a change. It's really surprising to note that in India, despite us not having concrete numbers to crunch at in terms of data, because government is working with just fictitious numbers. So whatever aid we are getting is just going through the air. They are just claiming things. They're just claiming things, and there is nobody accountable to these things. So largely the way Professor Linda spoke about these aspects, we need accountability. Until the time we actually get down to looking into these facts, things will just still remain very mysterious and not reach the right people. So I'm glad that we are bringing up forums like this, wherein we are addressing things like this, getting more people aware. So it's largely around the awareness factor, and I'm really glad all of us think alike. So I'm thoroughly enjoying every session that I'm attending, and so glad that I can be a part of this. Thank you.
Lamaji, where do you work?
I work with, I passed out of JNU. I work with a school currently. I've taught in Christ College for 2 decades. I made a very conscious decision to move from college to school. I work with an experiential school. We follow a very different kind of teaching. So it's more hands-on. It doesn't follow any of the board, ways in which we are stuck by either the CBSE or any of the central board. So glad to be a part of that. Yeah.
Thank you.
Thank you.
Could I just make one little comment? I'm, as regards to the speaker just now, I would just like to say accountability is about knowing the technical language of the people who are making the decisions. So that's why accountability and understanding the language of accountability is so important. So whether you learn it now or at your own leisure, please do engage with the technicalities of this, because they are making decisions for us if we don't have the power and the knowledge to make them for ourselves. Just to name that.
Yeah.
Mhm.
May I add something? And please, that is where we need to empower our women, that's where we need to empower them to get them to understand this. So we've taken on this initiative to get much more women, not necessarily only women, because it should not, let's not again think that feminism is only around women. Very many, very active people engaged in discussions of this kind. Yeah. So thank you.
Yeah.
Thank you so much. I think we can move ahead to Kamalesh Gulia ji. If you've not given an introduction yesterday, you can go ahead with it.
Yeah, hi everyone. Good evening. Can you hear me?
Yeah, good evening.
Yes, I am so blessed to listen to all these eminent speakers. And I'm working in Sri Chitra. I'm a senior scientist. So senior in Sri Chitra, we have a strong group of public health, Mala Ramanathan. So I am very interested in anything which is about the women's problems, whether in a healthcare or gender equity or anything. So when I saw this, I was fairly interested in being it in the evening. So I'm sitting, I want to hear, because in the society, what happens is only 5%. The change. I see even very elite people, they pretend to be, very considerate, but at the back of their mind, they are not. This is my personal experience. I mean, you see small positions, that when women get, I have seen the men walking out to show their, displeasure or whatever, So this is there. I think I don't know how the society at least will come at least to a 40-60% or that ratio. That I don't know whether it is by inherent, like father to the daughter, that come automatically. There is some paternal care or that is inherent or genetic. But beyond that, I don't see it sipping into the society. So if you can throw the light, like Professor Linda and Madam Professor Patel, I mean, I feel, I can't help, we cannot enter into the brain, but sensitization, of course, but it is long way to go. That's what I can say.
We have to continue our effort, yes.
Ma'am, I have a suggestion. Can we do the remaining introduction tomorrow also, so we can
Yes, yeah, you can
space
take
it
your
out so that we
presentation.
won't be in that time.
Yes. Please go ahead.
Yeah.
Sure. Thank you so much for the introductions of the participants. Now I would like to invite Professor Dr. Vina Vaswani, Director, Center for Ethics, Professor, Department of Forensic Medicine and Toxicology, Yenepoya, Deemed to be University, Mangalore, for the second session of the day on health, gender, and climate change. Thank you for joining us, ma'am. Over to you.
Thank you. Can you see my slides?
Yes,
Can you see them? Yeah, fine. So at the outset, I'd like to thank Vibhuti ma'am, IMPRI, which has constantly put me on a path for self-improvement. Because every time I get an invitation, I may be a teacher to everyone, but I'm more of a lifelong learner. It's an opportunity where we bring our viewpoints.
Vaswani, health, gender, and climate.
Yeah. Would like to introduce you something, or shall I carry on?
No, please go ahead, ma'am.
Okay, thank you.
You can also go full screen. We cannot.
Sure. I'll do that. Yeah. Can you see that now? Yeah.
It's a working. Now it is full screen.
Fine. Great. I was more enthusiastic in getting my presentation through, it looks like. So yeah. So as we see, when we look at gender, health, and climate change, it's so interesting to me that there are two aspects to it. What we talked yesterday was about the institutional climate to gender. And now we are talking about planetary climate to gender. But both of them in their own sphere are influencing the gender. In an institutional setting or a community setting, how one looks at gender through the patriarchal lens. And then you have the climatic conditions that are human-made, but the impact of which is borne by everybody, but impact is much more profound on females, but the leadership is again in the hands of male. So this is something that we are going to grapple with when we look at it. And before that, I'd like to bring 2-3 instances, because that was so close to my heart that it was being discussed when Professor Linda Lane talked about the lived experience of doctors. And so I just was reminded of my own delivery. When I went for my to deliver my first child in an institution where I did the ANC, the doctor said she's giving me a compose injection and she's coming next day to deliver. And I knew that being a primey and I'm having a borderline contracted pelvis, small pelvis, I needed more care at night if something goes wrong. And she said, you may be a doctor, but to me, you are just a patient. If you want to stay here, or you can go to any other hospital. So on times like this, when it was so raining in July 21st night, we set out to different hospitals. I'm 9 months pregnant, complete. I'm in labor pain. 3 hospitals turned me back. No, you can't, because you did not do antenatal checkup with us, so we cannot see you. Then the place where my mom had delivered me, that was about 80 kilometers from this place, because that was where the dam was being constructed. My mom and dad were engineers. So they had done the mapping, and the person who was in the hospital knew them. And to his hospital, we took a car and went. It was flooding. They had to push me along with me, the car out of the flood water. We had to come back. 3 times we tried. After 7 hours, we reached the hospital, and I delivered an hour later. That is as a doctor. My husband is a doctor too. But this is what we faced. So it is like nobody is insured for a good health care. But a lot depends on how you voice your concern, how you put it across, and who knows you. If you know somebody, things go on very well. If you don't know somebody, things go on very tough. So even though I was doctor, my husband was doctor, we were in a new place to deliver, my mom's place. We had not been there before except for antenatal checkup. So for them, I was just somebody else. So it's important that even as doctors, even as females who look upon you, you cannot always think that there is a sensitivity in when they treat a lady patient. Second is what Aishwarya was talking about, gender in medical education. Why didn't somebody teach us this? In forensic, I can tell you the day I joined forensic medicine MD, my HOD said, you get out of this door. Do you think it's as easy as making roti? What do you think about forensic? What do you know about forensic? Why did you take forensic? In fact, my mom said, he's your well-wisher. He's telling you what is lying ahead of you. You better back off. But then I said, no, it's not my nature to back off. I will face all consequences, but I have to go. So that is how the gender, totally the patriarchy is everywhere. But the gender sensitivity is only in some pockets. And if you're lucky, you come across those pockets, you have a role model, and then you start making a change for yourself. And lastly, I wanted to bring this an examination point of view, how patients felt, and how as a medical student I felt. And I felt I was always an outlier even in the medical days. I was presenting a CA breast case, and I was asked to bring about as many patients as possible. And I had a collection of 9 cancer breasts in different stages of different types of cancers, different histopathology reports. And all of them were made to sit with the breast exposed. I could see the tears from one of the girls. I was trying to close, and my head of the department shouted and said, get out. If you're so sensitive, why did you take medicine? So where have we lost sensitivity? We didn't lose, we never had any. There were very few people who could speak out because of the power inequality. I was a second MBBS student. Dare I speak to HOD that this is not right? No. But then what did I do? I got least interested in that subject. I detached myself from that learnings. So this is exactly what has happened over a period of time. And it is time each of us, I'm not only talking about females, because I also tell you with this, that knowledge that even women are as masculine when it comes to thought processes. It's like a mother-in-law syndrome. I've suffered a lot with my mother-in-law. It has made me a better person. So let my daughter-in-law suffer. What's so big about it? Why is she crying about it? So that is the kind of thing we need to be in solidarity to understand the plight of females. And we don't have to think every male is against us, but we need to look for sensitivity and who are those who are sensitizing and who are going to be with us that we need to include our circle. And sorry for that introductory remark. And I'll start my presentation on climate change, a brief overview about exploration of relationship between health and climate change, gender, health, and climate change. We'll examine how climate change impacts health outcomes, especially in different genders. And it will highlight unique challenges and opportunities faced by women and men in context of climate change. And we discuss gender-sensitive recommendation. So gender refers to a socially constructed role, whereas when we talk of sex, it is only anatomical sex assigned at birth. The influences how people perceive themselves and each other, how it interacts, and how is the power distribution is so contextual, culturally related, and also a part of education. But education does not change the mindset unless one wants to change their mindset. So unlike biological sex, which refers to physical and physiological societal differences, the gender encompasses a range of identities. So it's not just male, female, as we are born to believe, but there are different spectrums, and we should keep ourselves open to understanding, unlearning what we have learned, and learn the newer things. Because the knowledge is not definite within these four walls of my understanding. When it comes to a change in, we call it trends, of fashion, we are ready to do that. But a change in thought process, we are so rigid, we don't want to change. We would question the very assumption, who said there is a third gender? So even today, if you see, courts have sympathized to that extent, but as a commoner, we have not sympathized. We still have our own way of, but we would like to, but what about this? So gender roles and expectations shape across access to resources, opportunities, decision-making process, affecting health outcomes and responses to climate change. Now, like I said, we talked about institutional climate. For a person to work, how does it look at the gender? Now we are looking at even the external climate, a planetary climate, how it influences. So health is a state of complete physical, mental, social well-being, not merely absence of disease. In fact, today, we also add components of spiritual well-being. If I pray for somebody, I should be allowed to give my prayer. If somebody says, you cannot pray to this, but you have to pray to this particular entity. You cannot pray in this particular place, but you have to pray there. These are small things, but then they question the very ethos of beliefs of a community. So it includes various dimensions: physical, mental, social, psychosocial, spiritual, and social health. It's influenced by socioeconomic status, education, neighborhood, and physical environment. But men and women experience different health risks and outcomes due to biological, social, and economic factors. Now, how many of us know that we women outlive men by 4.6 years? But is that a happy thing? No. When you match the age for men and female, the women have more frailty and more diseases, comorbid conditions, so that 4.8 years is no added boon. It's only more to do with comorbid conditions that they have. So climate change refers to significant changes in global temperature and weather pattern over a period of time. And climate change is a natural phenomenon. Recent trends are largely driven by human activities. But then we have done it, but who should do the cleaning up? Now we think only the advanced countries should do the cleaning up because we know we are LMICs. So we should be given the license to dirty the world the way we want to. But the educated, the so-called developed countries should do the cleaning up process. Now the developed countries, on the other hand, say, why should only we do it? Everybody does it. But in the end, what happens is like we have so many ministries for environment, but nobody is singularly accountable. So climate change leads to a range of environmental impacts, increased temperature, rising sea levels, and extreme weather events. Of late, we have been seeing the summer, the temperature has never been before in Mangalore. It's, I think, like 120 years or so, it has not been this hot. And now we have rains, it has never rained like this. Where 120 to 130 millimeters is the maximum rainfall, now it's crossing 400. We have landslides and other things. We blame the laboratory, which has reported that. We said it's not correct report, but we don't have an instrumentation state of the art to for that matter, because that also will bring us added responsibility to take care if we know beforehand. So climate change affects health through direct impacts, heat waves, natural disaster, and indirect impacts like food, water insecurity, vector-borne disease, and mental health issues. Now, intersection of gender, health, and climate change. The climate change affects genders differently. Women and marginalized groups often face more vulnerability due to socioeconomic, cultural limit of their adaptive capacity. Now, when there was what I would say, there was this gag on the notes, and overnight the 500 rupees note became functionless. What about the daily wagers? What about the COVID time lockdown? At least some people had some money in their banks, while some had nothing fixed to rely on. So who were most affected? Were the migrant, unorganized sector. So that is how, when we talk of climate change, the impact is directly on these vulnerable people. And women are also vulnerable to the extent if they don't hold a regular job. Even if they hold a regular job, they have extra burden on them of caregivers. Caretaking within the family, making food and other responsibility added on to them. They do not have a concession because you're doing this, you cannot do this. Because that is how the economy is maintained, that you work more, you earn more. But you don't save, you save money by not having more servants at home. So vulnerability and adaptive capacities are not uniform. They vary significantly across different genders. And what is the intersectionality? It's a framework. Imagine there is, like you say, a white and a brown color. So the brown color is always looked down upon the white. Especially in case of forensic investigations, also in case of judicial, wherever you go, there is suddenly the color becomes a tool with which you discriminate. Similarly, you have with gender, the male is somewhere superior to female. But a brown male is still inferior to a white female. So this kind of sections that cut across, you may be superior in one aspect, but there are other power inequalities that bring you totally down in some other and put you in a vulnerable position. So they have a disproportionate impact. For example, in developing countries, economic disadvantaged persons are more likely to live in areas prone for environmental hazards like floods, air pollution, exacerbating health risks. If you have less income per month, you would end up in area which is most congested. But if you have lot of resources, infinite, then you could stay in Bandra, Pali Hill. But that's not everybody's cup of tea. So it also decides where you're staying, and it's also directly proportional to the congestion and the pollution and the impacts of a disaster, flood or anything, where most of the people out there are if affected. So intersecting identities influence vulnerabilities, socioeconomic class, access to services, access to resources, caste. In fact, one of my postgraduate did a study with me on the manual scavenging and what is the impact from, especially from what do forensic people think about manual scavenging vis-a-vis human dignity. And do we even know that when we are writing a cause of death and investigating that they may have not got any kind of care? So how can we make it a better place? So the social support system, the race, the ethnicity, and similarly in India, we have layers and layers of region, a community, a class, a subcaste, and so on. So these are marginalized groups like indigenous communities, low-income groups, women in rural areas, and elderly people in coastal regions. They're at a high risk of health issues due to rising sea levels. If the flood was to suddenly wash a part of the town, you think the 80 plus years would have enough courage to run, jump, sprint across? So they would be rendered vulnerable. So global impact of climate change, it's a global phenomena affecting ecosystems, weather patterns, sea levels, but most importantly, it affects health through food security. Migrating, you have lost touch with your healthcare system locally. Water resources, you don't know what water you're drinking, whatever is available. And also once you have lost your job, you don't know where the next meal is coming from. So these are key factors contributing, like agricultural practices. When you use a lot of fertilizers, are you even aware there is a Cancer Express that runs from Batinda to Ajmer every night, and it's crowded with people? Why are they having so much cancer? Because the water bodies are filled with pesticides. They consume the same water, and then the plastic cans in which the fertilizer comes in, they store water. So you have it all. Similarly, greenhouse gas emission, burning of the fossil fuel, changing of the crop by burning, and cooking in open, where in a small house, one-room house, you do the cooking on the coal, and then everybody inhales the fumes. Cutting down of forests. Anything that gets cut here is wages and forests. So easy. Nobody can say anything about it in the name of progress. And then the industrial production. Industries are so easy to start. Nobody inquires what is the end product. How is it going to be managed? And how does it impact the environment? Because ultimately, we are thinking the money carries us through, but that is only a wrong post to follow. The goal is only environment, a clean environment see us through. But now we are not interested because cleaning up is not our agenda much. We may want to show it, but we are not acting upon it. And waste management. So the climate change impacts the environment by rising sea levels, especially whenever there is a rise in sea level and it has gone back, a lot of mosquito-driven infestations, parasitic infestations, because the water level has lost its usual healthiness. Then temperature increases, extreme weather effects. So these are, as a result, there's a greenhouse gas accumulation. More industries we make, carbon dioxide covers the earth. So the sun rays are not reflected back, but rather they're converted into UV rays, and then they literally impact on our health. Skin cancer, skin diseases, lot of cancers. Global warming results in natural and human produced emissions. They warm up Earth's atmosphere. This is called the greenhouse gas. And it's naturally occurring human-induced emissions. These emissions are not healthy, and they cause the earth to warm faster, and it results in flash floods. So how many of us know that the impact of such a global warming is that by 2025 or 30, Mumbai, Mangalore, Cochin would be much underwater. They have a higher chances. And when you look at vulnerability, Indian subcontinent will lose 14,000 square kilometers of land if sea level rises even by a meter. Now, when we are talking about it, you might think, so what? It affects everybody equally. So how are we talking about the risk to only women? Here we come. So death and illness, frequent extreme weather conditions because of storm and floods. But what is more important is climate change is a social determinant of good health, livelihood, equality, access to healthcare and social structures. With such an arid place, what can you grow? And how could a lady cook? How much distance does she have to walk to get a pot of water? That automatically means you pull the girl child away from school. You put her in the business of carrying water. So mother and daughters will go in search of water for cooking, whereas the men will go in search of bread. But the impact on the health is more acute because here even the young girl has lost her education. So the climate sensitive health risks are disproportionately felt by vulnerable and disadvantaged, including women, children, ethnic minorities, poor communities, migrants or displaced persons, and also older people. To that, from our behavior, we clean house all right, we use best of the vacuum cleaners, but we dirty the environment to a huge extent. We think the 4 cement walls are our house, but actually our house is a planet. That's where we get our oxygen from. Our house doesn't make oxygen to give us. But our loyalty is so badly misplaced that we do anything. We kill people to have those four walls secured, but we kill people and we don't mind even causing biological disaster. Let the planet go to hell. But where is our priority? What is our home? These four corners of the house? Or is it the planet? So plastics also with the same behavior, it ends up in the sea, it into the ocean, fed by the fishes and also the cows and other things. Marine planktons, they capture carbon dioxide and release oxygen. But today, the pores are blocked by plastics. They're not able to produce oxygen to the level they were doing before. So we are putting ourselves in a toxic atmosphere. So climate is a new challenge. It's a global phenomena. It has a skewed vulnerabilities. It has unfair emission levels, but only few people who are affected are those in most congested places and they don't have a reprieve of a healthcare. So theoretical tools are underdeveloped to study, and even if you have a best of the studies, your results will not be accepted if it is not conducive to economy. Because now we have decided to put economy in the pedestal and hero worship. And this has been, the climate change has been like an unwanted aunt who's just going on making rumbling noises. Don't listen to her. So somewhere we need to prioritize. So we had to look at justice. Like Dr. Linda was talking about ethics. Yes, it's always ethics. Here talk of ethics, intergenerational ethics, intragenerational ethics. And the scientific uncertainty going this way, how far does it take? We need to be cautious of it. Humans versus non-human versus nature. Does that mean our economic exercise should curtail everything on the non-human and nature? All the animals suffer, we don't care. Nature has gone totally kaput, but we don't care. So the standard economic approach to environmental problems, what are we doing about it is we want economy, but economy does not produce a liter of oxygen. Ultimately, the nature has to be looked at before it's too late. So combination of civil rights, environmental protection, safe, healthy lifestyle, and giving a good environment for everybody. So most people of low economic position are exposed to high level of pollutants. And most of this because they do not have a resource at their command to change their place, to go for a better work or aquaguard or everybody. People can barely make 2 times a meal for 4 people. They cannot afford such things like aquaguard and thing. So we need to look at how best we can give a potable water to people. It's well documented climate change exacerbates existing inequities. In this case, it's called the natural disaster. Immediate widespread devastation sweeps a community, country, and a region. Now you imagine there's a flash flood. People are vying to be rescued. How many of ladies with their children are able to run fast, jump across, climb somewhere? So they're left behind. So although I don't know if you've heard of Lord Birkenhead's drill, that's what in forensic we learn when there's a rescue operations, ladies and children first, they say. But it doesn't happen in all rescue. It is whoever gets to go first, go to the boat or the ambulance, they get packed into it. So when climate process gradually alters productivity of soil, pattern of rainfall, then again it's the nutrition that is hampered. So this is one narrative. We the women are responsible for feeding our families. The bush has now become a desert shrub in my area. There is nowhere to go to fetch wood. One day, unable to find enough wood after a long search, I used some branches to cook. Since the wood was not enough, I cut my plastic bassinet into pieces to fuel the fire. Remember, when you burn plastic, it's also carcinogen. Many people put all the plastics together and burn, but then that they fume as much as benzene fumes. Then I cook the wooden bench. I took the wooden bench where I was seated and cut it to feed the fire. So to what extent should a lady go on compromising on whatever is there to make a food? So the impact, especially women are vulnerable because they primarily constitute majority of world's poor. Women are more dependent on livelihood on natural resources that are threatened by climate change. They face social, economic, political barriers that limit their coping capacity. Those charged with responsibility to secure water, food, fuel for cooking and heating face the greatest challenge. Ladies are washed ashore when they go to get water, or they get drowned or they slip and fall. And then sometimes with children, sometimes the wells are so deep, they literally fall into trying to look whether there's a water so they can draw the water up. So those charged with responsibility for food, water are the most affected. Pervasive nature of feminization, that is poverty, in poverty in females. One of the 1.3 billion people living in the deepest levels of poverty worldwide, and majority are women. More than 70% women, and they are poor. Women work 2/3 of the world's hours, but yet they are poor. Why? Because they do service that is not appreciated, not paid, and they are considered more of a liability or a burden because the care within the family is not considered as something tangible. So women produce half of world's food. In rural areas, women produce 60 to 80% of the staple crops, but they may not have food at the end of the day because they sell it, put it to market, and it goes into a large family. And yet women earn only 10% of world's income and own less than 2% of property. In some countries, they cannot even own lands. So they have to continue to be in some working for somebody else, having a meager wage. Feminization of poverty refers to a trend of increasing inequality in living standards between men and women due to widening gender gap in poverty. In many places, even the payments are not equal. If you look at a construction site, women are paid less than men. This phenomenon largely links to how women and children are disproportionately represented within lower socioeconomic status community in comparison to men of the same status. If the family has an economic problem, the first thing to get from the shopping list are the girls' sanitary napkins. They're the first ones to go. So whatever the ladies use, they're the first one to go because ladies are expendable. So it shows a clear differences in how climate change impacts women and men and their respective capacities for coping. Existing condition and existing discrimination determines who is most impacted by natural disasters. Actually, in London School of Economics, a study examined that disasters had occurred in 141 countries from 1981 to 2002. The study found that natural disasters lower life expectancy of women and the disaster intensifies. The effect also is more on women. 85% of people who die in disasters are women. Another conclusion that was drawn that was societies where inequality between men and women is vast, women are more likely to die from disasters. So these are some of the health impacts directly due to health waves, natural disasters, and indirectly food security, vector-borne disease, and water quality and quantity. The important healthcare issue is trauma and stress. Depression, anxiety, post-traumatic stress disorder, and psychological trauma. Sometimes men have a social circle, they meet up, they drink together, they have more collegiality, they even talk about their problems together. Whereas most of the women, they find it's difficult to go across, talk to somebody, talk about it, and also chronic stress conditions relate to climate and also socio-economic disruptions. So the example of exacerbated poverty cycle, it starts with, let us say, increased burden on the household. And so the less time for education for children, they're withdrawn from school, then unsustainable coping strategies, deforestation, you go on cutting whatever you have, you use, but there is not enough growth of wood, and so you don't have it, you have to walk longer distance, environmental instabilities, and insecure livelihoods. This is how a vicious cycle continues. Whereas the role of women, it can be in a huge positive way if given a community leadership, if they're brought into where they can design the methods in which they can do, because they have leadership, but they don't get a voice. It's like somebody wants to say something, but the mic never comes to them. So they have to stay quiet. So whereas women's traditional knowledge, especially if you recall in COVID-19, the countries that were led by ladies fared much better because they have an instinct for a decision making in crisis. And so women's traditional knowledge and innovation also could be called to help. Advocacy and policy encouraging women to take part. Education and capacity building, at least if you can restrict that no child should be pulled out from school for whatever be the reason, like you have a food for work, the similar thing can be done so that the girl child continues to be in school. And environmental stewardship. What do we do with the environment except cutting trees and making fuel out of it? Have we actually, our efforts to restore environment is minuscule. It is very little compared to how much we draw from the environment. So roles of men is also very, very important because it doesn't mean that only women have to work towards women. Involvement in high-risk occupations where both men and women can take part, community-based adaptations, rising awareness, participatory approaches, and supporting gender equity. Because when we talk of gender, people you see mostly females are there except exceptional males like Amar Jasani. You see Dr. Ravi also coming and taking part. Few males that are there far apart, but now they're increasing. But otherwise people think anything to do with gender is only females. So we need to be very sensitive when it comes to allocation of equity resources, decision making, especially supporting capacity building, addressing intersectionality, how a particular decision across, how does it impact other people, ensure inclusive participation, and enhance adaptation and resilience in reducing vulnerabilities. So what we can do is to limit global emissions so as to reduce risk of severe or catastrophic impacts, especially in our universities or wherever. We also have eco club, and we try to encourage use of cups, that students have to carry their cups, have their tea, just wash, rinse and come back, then use the plastic cups, because they also have a wax lining. Having cup into that and drinking every day, you're also drinking a part of the wax that goes into stomach, one of the responsible agents to cause cancers. So we don't know many of the things that around us, including the non-stick tawas that you use. Once the non-stick Teflon has gone, we continue to use it, constantly leaches chemical. So we should be aware of what a healthy way of lifestyle. I carry a spoon wherever I go, because wherever you're given something, you may not have a water to wash your hands. At least you can rub a spoon and eat from it. So these are some small things in our own day-to-day life we can make changes, and need to have a precautionary approach in the environmental law and policy to see what are the other alternatives to enrich environment, to sustain environment, to reduce emission, and especially to intergenerational justice. What do I owe to my grandchild and to the great-grandchild? Do we owe a duty to them or nothing at all? If we owe them the duty of a green planet, then it's our duty to keep a planet green. But we somehow think if we leave a big fat bank balance, that will be enough. But then there will come a time when the children will be, from the showcases, they will say, this is coconut tree, this is this tree. Because they'll be staying in some other planet. It will not be good for habitation anymore. So cutting down on emission is a serious matter. Installing solar bulbs, growing more trees, conserving electricity, and financing programs for climate change, adaptation for specific parameters for women. Encourage women leadership, encourage solidarity with women, put their produce for sale, let them take that leadership. So climate change is a global challenge. It impacts not just the climate, everyone. And those with less money are more susceptible. And 70% of the world's poor are females. So ultimately we can see it, it's going to cause huge imbalance. So we can work towards future where all individuals are better protected and empowered to thrive in the face of climate change, understanding unique strengths and resources that different genders bring to climate resilience can enhance community and global response, integrating gender perspectives into climate policies. That leads to more and more effective, equitable solution. Whenever it came to women dialoguing, men always said, we are having serious decision, we'll attend to your problems later. But their problems are no different from this. What you are making a problem is what they are facing. So unless you include women in your decision making, in policy as well, planning and policy and implementation, it's not going to be your problem and our problem. This otherification of female or transgender is not going to help. It has to be all inclusive. It's time to look beyond my duty to I, me, and myself. We have been too self-centered. Here, myself means my house, my community, my country. But then my duty should be to my environment that sustains me. We need to look at the stewardship of the environment, look beyond economic enrichment to a sustainable green future. What can you add as a green initiative in your day-to-day life? So, and then I would like to acknowledge Akuma Ifanichukwu. He has made some beautiful slides for us. And also he had intellectually held certain conversations so as to remove some flab and add some important information. So here what we see is a pre-ethical past where you're concerned with only self, I, me, myself. Ethical past where you have a large tribe, community, religion. Presently, we also have nation, race, humans, but we are not included animals. But in future, we expect that humans, plants, animals, life, rock, ecosystem, planet, and the entire universe is a part of our cleanup operation and not just making money as a part of ambition. So that is about it. So all of you, those who look the other way every day because you seem more frightened of the change that can prevent catastrophic climate change than the catastrophic climate change itself. We are afraid to look in the face what changes we have to make. But imagine what world we are leaving for the next generation. So for them, your silence is worst of all, says Greta Thunberg. So these are my references. Thank you very much.
Thank you so much, ma'am. That was highly insightful. I would now like to invite the chair, Professor Vibhuti Patel-ji, for her remarks. Over to you, ma'am.
Yeah. So thank you, Professor Vina Vaswani, for making such a comprehensive this thing. So many of things were like they were resonating with the experiences we had at the time of tsunami, okay, and also in the current the recent pandemic, what is happening currently in Kerala and also Uttarakhand and Uttarkashi, the way things are and there. The feminist New Green Deal, which is also based on the experiences of our foremothers in Chipko movement or in a Save Amazon campaign and this thing. So I think it is very important to include, as you rightly said, that women's voice and representation are very important. First time when the climate discourse took place and UNFPA came with a document, there was no word called woman or a gender in it, and it was only after a global uproar by the women's studies and gender specialists that they came up with a new document on gender and climate change, and also the ground level experiences of relief and rehabilitation in the climate crisis, whether it was in Katrina, where transgender community and elderly people were left out, where person with disability did not get any relief the operation. Tsunami waves killed more women and children because they were not taught swimming while the boys knew how to swim. The dress code, the clothes which men were wearing half pant or so, that saved them while women were in sari, and that also caused it got entangled and it created death due to suffocation also. So the question of linking it up and intersectionality is very important, because when it comes to climate calamity, elderly health, community care, nature care, care of water bodies, green cover on the earth, care of air quality, all these examples that you have given are extremely important. And this care work reduces the negative impact on environment and thereby moves the national economies towards decarbonization. I think that has been brought, that has brought in all the meetings, global meetings which are taking place, which are called COP, Confederation of Partners, and gender responsive budgeting becomes very important. at both national and subnational level, because public investment in terms in social infrastructure, because those who are in a pakka house, they are less prone to climate calamity than those who are living in the bastis. Recently, we had a heavy rains in Mumbai. Every year, when we have heavy rains in Mumbai, people who are in informal settlement, they are the ones who get completely, their houses are destroyed. 300, 400 houses in one slum gets destroyed, or the people who are in dilapidated structure, they are the people who become homeless. So I think it is very important that even when we do the micro planning or meso level planning, subnational and national planning, we need to keep the intersectionality as a intersectionality approach becomes very important. And I think there are so many learnings from the examples that you shared with us. And we also every day we are facing climate calamity, like see the air quality in metropolis. Bombay this time surpassed Delhi, or even the deluge, the impact of deluge in several parts of the country, which is happening now also. And what is happening in Wayanad, more than 400 people have lost their lives. And it is not that they were not enough studies were there, that there were many studies, many alerts were given after tsunami. It had become a very important agenda of reduction in that and destruction, but still nobody listened to them. And that this kind of calamity is repeating. But here too, the commendable role is that of Kutumbashree, like it's a self-help movement of Kerala, which stood by the people, affected people. So we never heard a report of, say, trafficking or selling of children or this thing in case of Kerala, because of the consciously and a commitment with which Kutumbashree worked at a ground level. So I think at one level, women are victim of the climate calamity, but at the same time, they are the ones who are the most resilient and who are the ones who provide very life-saving support to the communities. So I think very extremely interesting learning from your presentation.
Thank you so much, ma'am, for your invaluable remarks. The floor is now open to questions from the audience. You can write your questions in the Q&A box or raise your hands and speak. Yes, Linda Lane, ma'am, please go ahead.
First of all, thank you for a very inspiring presentation. But I would just like to add here that when I listen to you, it's like, well, we're at the end of the line. And I'd like to argue that we are, it is dire, but we are not, we still have some opportunities here. And one of the things I'd like to mention is the fact that women are at the forefront of trying to keep this planet alive. The problem I'm facing, and I think many of us who do research around this area, is the fact that nobody wants to listen to these women's voices. Yeah. They are there, they have knowledge, they have local knowledge, they know what is possible. I'm thinking specifically, my colleagues and I have been doing work around rural women in Orissa and their use of seed banks, saving indigenous seeds, which is possible to grow crops which maybe don't require so much water. They're using their own knowledge to kind of try to conserve the environment. At the same time, their experiences are being neglected by government, local officials, because the overall giant national plan just doesn't see these kinds of initiatives. So women are being neglected, they're being pushed out. And I think we need to try with, all of our might to kind of help the climate discussion be more inclusive of the voices of women in rural areas, women who are poor, who have knowledge of how to survive when things get tough. So yeah, it is a dire situation, I would agree, but I would like to think that the work of women and grassroots organizations around, not only in India, but in other countries as well, they are our hope for the future. So yeah, a little bit problematic, but there is hope. We shouldn't give up yet.
Yeah, no, it's not a question of giving up. Question is there's a lot of leadership, but we are not looking at them because they don't have the glamour of what you call the economy or kind of making it into a process whereby you mint money.
Correct.
So the question is, the end point of everything need not be economy. It could be renew the nature, renewable sources of energy. So there are alternate way of leadership, and every outcome need not be linked to money. But today we are literally coming into this process. Even as a doctor, if I've done a research, first thing one would like to ask a question, okay, can you upscale it? Can you make it an industrial model? Can you make a startup model? But why is the necessity? Is it necessary for everything to go in that order? So everything deserves its own place, merit and recognition. And this is where the leadership of women who have used nature to their advantage and sustained nature beautifully, we need them to be the role model. So that they have to be consulted, because the economy model is failing. That's what I wanted to flag.
Yeah. And now economists are also talking about the circulation model, circulating this thing. So whatever we are generating, it should, the nitrogen cycle should not be disturbed. The kind of industrial model that you choose, development growth model, circular economy. Jasmine M. Sangamach.
Yes, hi, Professor Vina. Your session is what I feel why I signed up for this, Monsoon webinar. It was so wonderful to listen to you, and you spoke with so much of passion, and I can see, and it is, I come with a family of my brother and my sister-in-law, both are doctors, and I've worked with many doctors and seen many doctors, but it's very few to find medical doctors advocating for climate, advocating for social issues as such, right? So much gratitude for what you do. I don't have a question, but it's more of I'm thinking out loud when you spoke about economics, when you spoke about mostly it's not just always about money, right? But somewhere again here I'm not pointing fingers to not pointing fingers, but it's just again I'm thinking out loud, is that we say a lot of hey, the emissions, carbon emissions, as simple as using of plastic and all. But if you see that the labor, the labor market in Asia is one of the cheapest labor markets. All the big brands in the Western countries are produced, are made, are manufactured in Asian countries. Where does the waste go? The waste.
We are also buying waste.
Yeah, the waste stays in our Asian countries, and the waste do not get not 1% of the waste. Either it is dumped here or either it is dumped in African countries, right? But the Western countries do not get our waste at all. And yet they are the one who is now advocating for climate change and advocating for this. And I feel like climate change is also a lot of not just economic, but it's a political political fight or political always a hidden agenda. And while we know that if you see the continents as such, right, like Asia, Russia, they're all the biggest continents that we have, and the maximum of the waste stays in the continents that we are producing, and the other richer countries are just taking away the best part of the produce, and all the waste part is dumped into the countries that is developing or third world countries. And somewhere I feel like it is so unfair that for a third world countries to be where everyone's advocating for it, but then the ones who are suffering the most, and I'm women and children we're putting in the list, but I'm just talking as a country, as a globalized global in the global level, right? So I think it's I feel sometimes more of being a woman, as a woman, I sometimes also feel like, how much do we do? What do we do? And where do we stay as a country? Where do we stay as I am in the last strata of the this ecosystem. But I think, sorry, I'm not getting a way to end it, but this is just my thoughts, thinking out just loud.
Very powerful.
It's true. Actually, I wanted to answer that we do have a lot of waste. It's almost like a dumping yard, including for contraceptives. Our women were most experimented with all possible contraceptives. They didn't even have with a follow-up. The complications were not even treated. But then the question is, if we are, then we should be smart enough to make a research on how to recycle it in such a way up, so that we are able to do something out of it. Otherwise, why are we taking so much waste? We have the biggest ship breaking yard, and that produces so much of carcinogens. It pollutes the entire thing. Okay, then why can't we say for 3 years our moratorium is only cleaning up the planet? All research will fund towards this. So there should be a way of responding to the challenges we are facing in a scientific way, because I also look at a science as a social stewarding, doing what is required by the community at this point, then funders are giving, so I would like to do only that. So if that becomes my agenda, if that is what is helping the country move forward in that, then I think we should consolidate our energies to that.
And some of the Asian countries have stood ground, like when contaminated dairy products were sent after the Chernobyl disaster, Malaysia did not allow it. Okay, all the ship had to go back because they said we will not allow. Such a tiny little country came up with that kind of a courage, which empowered Indian social activists also to file public interest litigation, because they were going to divert shipment to Indian shores. And we also said we are not going to accept it. We don't want people to die of cancer, no? So I think that is also very important.
It's important. The best waste management system is in Singapore. Such a small country, but they have done it so well. So these are the models that can be replicated. First you try in particular area, then it as a part of this thing, other states can do it. But that seriousness of the efforts.
Instead of commercializing pollution and polluting processes, it's best is to find the alternative, which is regenerative. Yeah, correct. I think there are two more, no? In the chat box, they have written. One person is from first one, Kamlesh Guliaji, and then I think Vandana. Yeah. You can speak here. Please unmute yourself. Yeah.
Good evening, madams.
Yeah, good evening.
I really enjoyed both the presentations today. And being new to, I mean, not totally new, like, but I'm learning more about, integrating gender with all the other aspects, like learning more about why gender is playing a very important role in today's life, because of so many problems a woman is facing. She has to come to the forefront, fight not only for herself, but for others also. And this platform is truly, giving me an opportunity to learn so many things which I didn't know, like, And madam, especially integrating gender and climate, honestly, I was wondering like what is this thing like could be there, like, but really you have beautifully brought it out and giving examples and all. And, there's each thing, I mean, I think it's nothing like, it's just so superficial, like, but as you delve deeper into it, you come to know the intricacies of it, and there is so much to be done, like. But as a woman myself, like, I mean, I feel like a woman should understand the other woman. That's very, very important. And especially unity among women at this point of time is very, very important. Then only we can, try to tackle all these problems, more in a collective way, and in a, in a what you call teamly effort, by giving a team effort. Thank you, ma'am. Thank you, Vibhuti, ma'am.
Yeah. Where do you work?
Thank you, Linda, ma'am.
And Najib, what is your profession?
Ma'am, I'm an oral pathologist, ma'am. I did my PGDBME course under Dr. Vina, ma'am, Uma Kulkarni, ma'am. That's the time when I met Dr. Amar Jaiswani, sir, and yourself. Yeah. Actually, nowadays, I'm not visiting the Center for Ethics much, like, but I've been in touch with all the, few of the programs, like, madam, whenever there is a possibility that I can, participate online, yes. I usually, I would love to participate, like, and I don't lose that chance. Like, thank you very much.
Vandana comes from Shri Narayana Dental College, Nellore, yes. we have a collaboration set with them. We go every year for training. Their ethics committee members. Vandana is the leadership role out there. Then we also have a collaboration with nursing college, which she also arranges this thing for them. She also is one of the resource person out there. She's very modest. She won't talk about it, but she's very, very fired with passion for bioethics and teaching research ethics and so on. Yeah.
Thank you. Thank you so much.
Mr. Kamlesh Gulia, I think you have written in chat box and you have asked something to Professor Vina Vaswani. Yeah. Would you like to speak? I think he's no more because he had written earlier. He's no more. Yeah.
Yes.
Seeing no more questions, I think we can move on.
Yeah.
So, ma'am, your closing remarks for the entire of the day.
Yeah.
Patel, ma'am.
Yeah, I think both the sessions were extremely mind-blowing. And the first one where Dr. Linda Lane talked to us about the accountability in healthcare system and how it helps us to explore possibility in the health system beyond service delivery to the wider areas such as policy, political commitment, administration, community approach and community's voice and representation. And it also highlights the relevance and importance in analyzing maternal health problem, which she took as a case study. So Linda Lane's session has highlighted the areas of influence for financial performance, political, democratic, and social accountability in maternal health, and generated synthetic constructs on the mechanisms of their influence on maternal health outcomes in general, and also respect, dignity, and bodily integrity in women, which this is the new area about which we are talking. It is basically the stigma studies and the Dalit studies and ethnic studies where they talk that it is not only just don't talk about human development or state entitlement and all. As the social security, social protection, and entitlement are important, these dignity, bodily integrity, respect are equally important. That is that there's a new dimension that has come into the whole discourse on which is on maternal health and also reduction in maternal. It's not a quantitative work of number of deaths, reduction in the death, but the whole process of how maternal health is being treated by the health system and the community. This can be applied beyond maternal health. The whole approach, the framework which you discuss, can be applied in all the areas of reproductive rights or health rights or the person's human rights. And I think what she ended up with that what we need is a reflexivity about our own biases. So it is very important to be conscious of our own prejudices and how to give up and share the baggages that we are holding because of our positionality in the social system and the privileges that we enjoy because of that. So understanding the language of accountability, she emphasized. And for the second presentation was extremely data-driven, and also so many case studies were discussed by Professor Vina Vaswani, where she talked about the promoting gender responsive and inclusive climate change plans. And I think the questions that this presentation raises is the one is about the gender disaggregated data, which we need for the climate calamities. Are the gender differential impact of adaptation measures understood and addressed? That the example she gave, and Dr. Linda Lane also gave example of Orissa. And what kind of adaptation programs reach the poor women? What are the additional financial resources that we need and in the disaster management plan and the programs and schemes and allocation, financial allocation that we have, and also decision-making presence of women and gender minorities in decision-making structures in climate-sensitive areas, very important. Even now, there is no legitimization of what our foremothers in Chipko movement, Apiko movement, movement or the Save Amazon campaign they gave to us, that has not been integrated in the official discourse. Only in they talk only in terms of the commercialization of whatever damage you do to in terms of carbon footprint. No, so that we have to go beyond that. And the last slide of Dr. Vina Vaswani also brought in the question that we are not only talking about human beings, but flora, fauna, forest, animals, birds, the whole ecosystem. That is, we should be sensitive to that. And we also, the crucial mandate for all of us is to initiate this kind of a debate, and it should be interdisciplinary public debate among pure scientists, social scientists, practitioners, planners, policymakers on gender and climate change, and also more the research on these subjects and wider dissemination of the researches which are done in the popular media and public education efforts that we are making. So women who are at the forefront of saving this planet, I think Dr. Linda Lane gave a very optimistic remark. And I think I also go by it, that the local knowledge that women have, we need to legitimize that knowledge. We have to amplify their voices and their efforts at conserving environment. They have to, and so many small victories and small success stories, I think we need to popularize it, and so that more and more people get confidence and inspiration to save the climate with the collective wisdom that rural women, tribal women, forest women have provided us. Thank you.
Thank you so much, ma'am, for such insightful closing remarks to the entire day of second day.
Yeah,
Now
thank you so much, Clive, for moderating the session so well. Yeah, in the IMPRI.
Thank you so much, ma'am. Means a lot.
Yeah.
Now I would like to propose the formal vote of thanks. As we come to the end of the second day of Healthcare and Gender Equity, Cohort 3.0, theme Advancing Systems, Structures and Policies to Address Contemporary Challenges, an online international monsoon school program, a 4-day immersive online certificate training course organized by IMPRI. I, Samprita Banerjee, researcher at IMPRI, Impact and Policy Research Institute, would like to propose a formal vote of thanks on behalf of the IMPRI Gender Impact Studies Center. We are grateful to our experts for the Day 2 session, Professor Linda Lane and Dr. Vina Vaswani, for taking out their valuable time and for their thought-provoking insights on the topics. We thank all our participants who have raised pertinent questions and actively participated in today's deliberation. Readings for the session have been shared in your email, and a video of the session will also be shared with you for learning. We are grateful if you're watching us later on YouTube or listening to us on our various podcasts or reading our publications. The feedback form will be shared after the entire course is over. Kindly fill it in to get your certificates on your email. We hope you continue to join in the future to our IMPRI Web Policy Talk and Web Policy Learning. With this, we come to the end of the second day of this course. Wishing you a good evening. Thank you so much.
Thank you. Thank you, Linda. Bye. Thank you, Professor.
Thank you. Thank you very much, ma'am. Bye.